Hello, Mind Maze community. Mental health is a crucial aspect of our well-being, and being able to recognize signs of anxiety and depression in others can make a significant difference. We often overlook these signs, but understanding them can be a lifeline for those silently struggling. We're going to dive into this topic and shed some light on the top 5 ways to identify if someone is dealing with anxiety or depression. Today, we'll explore the top 5 ways to tell if someone is anxious or depressed. Before we dive in, let's acknowledge the importance of being aware of our loved one's mental well-being. Mental health isn't always visible, and it's often the subtle signs that go unnoticed. Recognizing these signs isn't about diagnosing, but about understanding. It's about noticing when someone might be struggling and offering a hand. It's about fostering an environment where we can talk openly about anxiety and depression, shattering the stigma that often surrounds these issues. It's about realizing that mental health is just as important as physical health. This awareness is a powerful tool. It can help us bridge gaps, provide comfort, and most importantly, show someone they're not alone. Understanding the signs can open up avenues for support. One of the key indicators is changes in behavior. Now, we all have our off days, but when you notice a persistent shift in someone's usual demeanor or activities, it's worth paying attention to. This could manifest as a sudden disinterest in hobbies they once loved, or perhaps they're showing a newfound penchant for risk-taking behaviors. Remember, we're looking for noticeable shifts, not one-off instances. It's also important to note that these changes in behavior are not always negative. Sometimes people experiencing anxiety or depression may overcompensate by appearing overly happy or enthusiastic. It's this inconsistency between what we know of a person and their recent behaviors that can be a telltale sign. If someone is withdrawing from activities they once enjoyed or demonstrating uncharacteristic behaviors, it could be a sign of internal struggles. It's not about labeling or diagnosing, but about acknowledging these changes and offering support where it's needed. Pay attention to sleep patterns. It's a common misconception that sleep is simply a time for our bodies to rest. In reality, it's a vital process for our mental health, and changes in sleep patterns can be one of the first signs of anxiety or depression. Consider this. We all have occasional sleepless nights, but when someone consistently struggles to fall asleep or wakes up frequently during the night, it could indicate anxiety. On the other hand, depression often makes it difficult to get out of bed, leading to excessive sleep. So, if you notice someone in your life sleeping too much or too little, it could be more than just physical tiredness. They may be wrestling with an internal struggle, trying to cope with overwhelming feelings of worry or sadness. Both insomnia and excessive sleeping can be manifestations of anxiety or depression. Recognizing these changes is a step towards understanding and supporting their journey towards better mental health. Observe their emotional expressions. Human emotions are complex and can sometimes be hard to read. But when it comes to anxiety and depression, certain emotional changes can be telling. It's important to tune into subtleties, as these conditions don't always manifest as visible sadness. A person struggling with anxiety or depression might exhibit sudden mood swings, seeming fine one moment and despondent the next. Or they might be persistently sad, showing a lack of interest in things they once found joyful. They might also display irritability, reacting strongly to situations that would usually seem trivial. These emotional changes can be an indication of an internal battle. It's like a silent cry for help, a beacon signaling that something is not right. It's essential to approach these signs with empathy and understanding. Sudden mood swings, persistent sadness, or irritability can be flags. Don't ignore them. They are calls to extend a hand of support. Notice shifts in social interactions. We humans are inherently social creatures, thriving on connections and interactions. But when anxiety or depression takes hold, it can often lead to significant changes in these social behaviors. Individuals may begin to withdraw from their friends and family, becoming increasingly isolated. They might avoid social situations they used to enjoy, or they may appear noticeably uncomfortable or distressed in social environments. At times, they may even express feelings of loneliness or a sense of being misunderstood despite being surrounded by people. These changes are not always easy to spot, especially in our digitally connected but physically distant world. It's important to be mindful, to take note of these shifts, and to approach the individual with empathy and understanding. It's not about prying or pushing, but about extending a hand of support when it's needed most. Avoidance of social situations might be an indication of underlying anxiety or depression. Be attuned to physical symptoms. This is a significant sign that is often overlooked when it comes to anxiety and depression. It's essential to understand that our mind and body are interconnected, And emotional distress can manifest in physical ways. For instance, some people might experience recurring headaches or stomach aches that don't seem to have a clear medical cause. These could be the body's unique way of signaling emotional turmoil. Similarly, unexplained fatigue, or a constant feeling of being run down, can also be indicative of anxiety or depression. It's not uncommon for individuals battling these mental health conditions to also report issues like muscle tension, chest pain, or even rapid heart rate. So it's important to listen to these physical signals our body sends us. Remember, these physical symptoms may not be the primary indicators, but when seen in conjunction with other signs, they can provide a more comprehensive picture of someone's mental health. Headaches, stomach aches, or other unexplained pains can sometimes be the body's way of expressing internal emotional distress. Remember, recognizing these signs is not about diagnosing but about showing compassion and support. It's about being there for one another, understanding that anxiety and depression are not weaknesses but challenges that many face. By noticing these signs, we can encourage those around us to seek the help they may need. It's a testament to the power of empathy and understanding. Mental health is a journey, and understanding is the first step. If you found this information valuable, please subscribe for more insightful discussions.